to a chest pain.
So you will approach a patient with a chest pain. You will approach a patient with a cough. You will approach a patient with a knee pain. You will approach a patient with a headache. You will approach a patient with lower GI bleeding. You will approach a patient with upper GI bleeding. You will approach a patient with a PV bleeding. But you won't approach a diagnosis. This is what I want you to get. This helps you to decide whether the chest pain that you are seeing is a cardiac or a non-cardiac chest pain. So number one, it must be a retrosternal chest pain or substernal. Retrosternal. Number two, it must be substernal or it must be retrosternal, meaning behind the sternum. That's the location. Number two, this pain must be worsened or must have been worsened by exercise or just any activity, any physical activity. This chest pain must be relieved by rest or nitrites, taking nitrites. So these are the three things. I want you to pay attention or note the fact that I didn't mention anything about radiation to the left upper limb. I mean to the left upper limb, or to the shoulder, or to the jaw. Didn't mention any of those things. They are not part of this classification. Whether the chest pain radiates or not, according to this classification is not important. What is important is the location. Is it substernal or is it retrosternal? So, based on those symptoms, you can now say this is a typical chest pain. Typical chest pain, or it's an atypical, or it's a non-cardiac, or it's non-cardiac. When do you say it's typical chest pain? When do you say it's atypical? When do you say it's non-cardiac? If based on those three symptoms you have got all of them, the three of them, then it's called a typical chest pain. If you have two of those, it's called atypical. If you've got one or zero, it's a non-cardiac chest pain.